When someone comes to the office here for a Lasik evaluation, we try and educate the patient on all the refractive options. We do many tests. We do an orb scan. We do a corneal topography. We do sometimes an OCT to check the health of the retina. We refract them before and after their eyes have been dilated. Once we know the eye inside and out, and the patient has watched a 30-minute video on what Lasik and PRK are, we then sit down and take our time and try and educate the patient and answer all their questions. So when they decide what refractive procedure they want to move forward with, they feel extremely comfortable, not just with the procedure, but also with the surgeon that's going to do the procedure on them. And that's something we've done for years and we continue to do. And we feel the patient satisfaction as it relates to this is very high. With this, what is Lasik or what is refractive surgery? Well, what we're trying to do is alter the refractive potential of the eye to a point where people can see better without need for glasses. So there's a couple different options. Now, if you go to a practice that does 1 or 2 Lasik procedures every couple of months, then that's not where you want to go because you want somebody with experience. If you go to a practice that only offers 1 refractive procedure and doesn't offer any of the others, then you're sort of pigeonholed into this one procedure, then that's not where you want to go. Where you want to go for good refractive options is somebody that can offer you a wide array of refractive options, because not every refractive procedure works for every patient. There's many options out there of how to get people out of their glasses. The most common is either PRK or Lasik. Lasik is where we take the eye and we make a small flap, basically cutting through the middle of the cornea, open up the flap, we laser our refractive correction, put the flap back down, and that in turn is Lasik. Lasik and PRK we use the same exact laser. What's different about PRK is that we don't cut into the cornea and open up the flap. What we do is we laser right through the skin of the cornea. Some people describe it as polishing off the skin of the cornea, then lasering, and then allowing the new skin to grow back over the surface of the cornea. Now that's PRK. One of the options we have here for our refractive practice is Intralase, which is a bladeless Lasik. And basically, this procedure involves 2 lasers instead of 1. And when we cut your flap, we do not have to use a blade. Intralase is advantageous for people with very steep corneas, people with very high corrections, or people with thin corneas. Some thin corneas are too thin that we have to actually do PRK itself. But now with Intralase, the ability to laser a fine, more predictable flap, some of the people that we had to push on to do PRK now have the option to do Lasik, where they didn't have an option to do Lasik when we could only do a blade Lasik. So this is another option we have for our patients that we try and educate them on as we move forward into deciding what refractive procedure we need to do. When we decide to do Lasik or PRK on a patient, we do the procedure up at our laser center, Laser View of CNY, up in Liverpool, New York. The patient arrives at Laser View a half hour before their surgery. The procedure itself takes about 20 minutes, and they're out the door usually within an hour. There's somebody there, usually Autumn, that holds your hand throughout the whole procedure. I have my hands at either side of your head while you're looking up at a fixation light, and I'm talking to you throughout the procedure, letting you know that all is going well. The procedure per eye is usually 3 to 5 minutes. Patients come in with nice thick glasses, and they leave after having the laser. They sit up, and most of them can read the clock across the room. The joy of the patients seeing the clock, the initial grin that they have, I still enjoy it after all these years of doing the procedure. The patients are happy, and a happy patient makes a happy doctor.